Have you ever felt tired all the time or experienced aches and pains that don't seem to go away? One common yet often overlooked cause could be a deficiency in vitamin D, sometimes called the sunshine vitamin. In this video, you will learn how vitamin D works in your body, the symptoms that might signal you are low on it, the potential health risks involved, and practical ways to safely restore your levels. Understanding this essential vitamin could be a key step toward better health and vitality. What vitamin D does and why it matters. Vitamin D plays many important roles in the body. It helps regulate calcium and phosphorus levels, which are crucial for keeping your bones strong and healthy. Beyond bone health, vitamin D supports your immune system, helping your body fight off infections. It also influences your mood and brain function. Because it is produced when your skin is exposed to sunlight, many people don't realize how much they depend on natural light to stay healthy. Despite its importance, vitamin D deficiency is widespread worldwide. Factors like limited sun exposure, skin pigmentation, age, and lifestyle habits can affect your body's ability to produce enough of this vital nutrient. Recognizing the symptoms of deficiency. Vitamin D deficiency often develops slowly, and symptoms can be subtle, which makes it easy to miss. You might feel persistent fatigue, muscle weakness, or even experience unexplained bone or joint pain. Sometimes, people notice mood changes such as feeling more anxious or depressed. Slow healing of wounds or frequent infections could also be related. Because these signs overlap with many other conditions, it's important to pay attention to how your body feels over time. If you notice any of these symptoms consistently, it may be worth consulting with a healthcare provider to check your vitamin D levels. Why low vitamin D levels are a concern. Ignoring vitamin D deficiency can lead to serious health problems. Low vitamin D is linked to fragile bones, increasing the risk of fractures and osteoporosis. It can weaken your immune defenses, making you more susceptible to infections. Additionally, research suggests that insufficient vitamin D may play a role in developing chronic conditions such as heart disease, diabetes, and certain types of cancer. There are also associations with autoimmune diseases and cognitive decline. This makes correcting a deficiency not just about feeling better, but about protecting your long-term health. How to restore and maintain healthy vitamin D levels. The good news is that vitamin D deficiency can often be addressed through natural and accessible methods. The first and most effective source is sunlight. Spending short periods in direct sunlight several times a week helps your skin produce vitamin D naturally. Depending on where you live and your skin type, this may require about 10 to 30 minutes of exposure without sunscreen. However, it's important to balance sun exposure to reduce the risk of skin damage. Next, your diet can support healthy levels by including foods rich in vitamin D. Fatty fish such as salmon, mackerel, and sardines are excellent sources. Fortified foods like milk or plant-based alternatives, egg yolks, and UV-exposed mushrooms also contribute to your intake. Sometimes, diet and sunlight alone are not enough. In these cases, vitamin D supplements may be necessary. The form called vitamin D3 is preferred because it is more effective at raising your blood levels. It's essential to consult your healthcare provider before starting any supplementation to ensure proper dosing and safety, especially if you have other health conditions or take medications. Factors that impact your vitamin D status. Several common factors can lower your vitamin D production. Living in regions with limited sunlight, especially during winter months, can reduce your exposure. Spending most of your time indoors limits the natural synthesis of vitamin D. People with darker skin have more melanin, which reduces the skin's ability to produce vitamin D. Age also plays a role since older adults synthesize vitamin D less efficiently. Certain medical conditions, such as kidney or digestive disorders, can affect how your body absorbs or processes vitamin D. Being aware of these factors helps you take proactive steps to maintain adequate levels year-round. Conclusion. Vitamin D deficiency is a silent health issue that often goes unnoticed until more serious problems arise. Paying attention to your body's signals and understanding the importance of this nutrient can help you take control of your health. If you suspect you might be deficient, a blood test and professional guidance can set you on the right path. Have you checked your vitamin D levels before? What natural methods do you use to keep your vitamin levels healthy? Share your experiences or questions in the comments below. Your insights could help others on their health journey. Thank you for watching, and stay healthy.